Good day, everyone. My name is Mandalam, and I'm the CEO of Citrabio Consulting. First, I would like to start by thanking the organizers for inviting me to speak at the 2022 World Stem Cell Summit. I have been attending this summit for over 12 years now. This is a unique stem cell conference compared to others, as it brings together the drug developers, academic institutions, researchers, physicians, and the patient advocacy groups. Bernie Siegel, founder and co-chair of the summit, has been doing a stupendous job on bringing thought leaders together and raising awareness about stem cell research and its potential. This particular session, chaired by Dr. Praveen Ramkumar, is focused on regenerative medicine and cell therapy in India. My talk is going to be on the evolution of stem cell research and cellular therapeutics in India. Bone marrow transplant, or often called hematopoietic stem cell transplant, is the first use of human cells for treatment. This treatment is provided to patients whose bone marrow or their circulating cells are either contaminated with cancer cells or contains genetically mutated cells that are unable to produce normal cells. The transplant cells given to the patient could be their own cells, called autologous transplants, if their bone marrow cells are not contaminated, but the circulating or tissue cells are contaminated, or could be from a matched donor called allogeneic transplant if the patient's own bone marrow contains tumor cells or genetically mutated cells and thus cannot perform normal function. In 1956, the first successful bone marrow transplant was performed by Dr. E. Donald Thomas in Cooperstown, New York, for the treatment of leukemia. He pioneered bone marrow transplant for the treatment of leukemia, for which he received the Nobel Prize in 1990. In early 80s, few doctors from India came to the US to get trained, and then they successfully did the first allogeneic bone marrow transplant in India in March of 1983 at the prestigious Tata Memorial Hospital for the treatment of acute myeloid leukemia. Subsequently, other premier hospitals such as Christian Medical College Vellore, called as CMC Vellore, and All India Institute of Medical Sciences, New Delhi, initiated the procedure as well. Today, there are 97 transplant centers in India. A registry of a diverse group of potential stem cell donors has been established in India that can be accessed by patients living anywhere in the world. Approximately 19,000 stem cell transplants have been conducted to date in India. These comprise both allogeneic and autologous transplants. The purpose of these transplants is to replace and repopulate the patient's hematopoietic system with all different types of blood cells derived from the stem cells that are given to the patient. Main indications for allogeneic transplants include myeloid leukemia, acute lymphoblastic leukemia, severe aplastic anemia, thalassemia, and sickle cell disease. Main indications for autologous transplants include multiple myeloma, Hodgkin's lymphoma, non-Hodgkin's lymphoma in adults, and neuroblastoma in children. The sources of these stem cells come from either bone marrow or mobilized peripheral blood or umbilical cord. On an average, 2,000 transplants are currently being performed in India every year, and appropriate conditioning regimens have been established. In fact, it becomes very important to have a successful allogeneic transplant with only a proper conditioning regimen. Considering the population of the country, the number of transplants is still relatively low compared to US, where 20,000 transplants a year are performed. India has a diverse population, which limits the possibility of finding a good match. A good match of HLA markers is a prerequisite for a successful transplantation, as has been observed over the past 40 years or more. Stem cell registries and its size become extremely important to find an appropriate match, which is key to the success of the transplant. Besides bone marrow registry, there are a number of cord blood banks, public and private, in India that have been established that store umbilical cord blood units that can be used for transplant purposes. More trained physicians and availability of additional transplant centers could increase the number of stem cell transplants in India. Now, speaking about the cost, The cost of an allogeneic stem cell transplant in India is in the range of $17,000 to $22,000. This is an order of magnitude lower than what it is in US. Now, new therapeutics, including immunotherapy such as CAR T therapy, may replace the need for stem cell transplant, especially autologous transplants, for certain indications in the future. Now I'm going to focus on certain genetic disorders that are more prevalent in India and do not have proper treatment modalities. Sickle cell disease and thalassemia are two inherited genetic hematological disorders encountered in children. They both affect the normal hemoglobin function. They are serious diseases that cause fatigue, jaundice, and pain, and in many cases could be even fatal. Many of these kids do not live past the teen years. Both diseases are very common in India relative to other countries. Although sickle cell can be treated and managed with healthy diet, folic acid iron supplementation, and number of therapeutic measures, it is not the case for thalassemia. India has the largest number of children with thalassemia in the world, over 100,000 existing cases, and over 10,000 children born every year with that disease. Although this disease is managed by blood transfusion, the only cure today is bone marrow transplant. So what's the current status in India? Now, bone marrow transplants are is the only cure, as I mentioned before, but they're difficult for these patients for the following reasons. The cost of bone marrow transplant is not affordable for the parents of many of these patients who come from rural parts of the country. Again, lack of sufficient bone marrow transplant centers in all parts of the country makes it inaccessible for some of these patients to actually get treatment. Not to mention, as I talked about before, matching is extremely important, so inadequate pool of donors becomes very critical to get a good match, and that's been an issue. So the mainstay treatment today is repeated blood transfusion, followed by iron chelation therapy to remove excess iron. Center of excellence has been established, and patient advocacy groups have emerged to deal with this disease and bring awareness. The government of India is very involved in the efforts to find better treatments and cure, and hopefully be free of thalassemia in the next 5 years or more. CMC Vellore gained reputation for conducting stem cell transplants in sickle cell disease and thalassemia patients. So regular blood transfusions also can be a major issue for these children, not to mention the potential of getting infections from these transfusions, but also not that all children may not be able to afford the regular transfusions that are required. Major hospitals such as CMC Vellore has been pushing for and has pioneered the use of bone marrow transplant for the treatment of thalassemia. They have studied extensively and optimized conditioning regimens that have led to better survival rates. Now they're also exploring other therapies, such as gene therapy, considering the issues related to bone marrow transplant. So in the case of a gene therapy, the approach would be to take the patient's own cells, so it would be autologous stem cells, that would be genetically modified to correct the genes. And you could do it one of two different ways. Either you could introduce a viral vector that would correct the gene, and then you give the cells back into the patients, or you could gene edit the cells and then give the cells back to the patients. So now the patient hopefully has normal function. Preliminary clinical trials have been encouraging, and the hope here is to have the patient be transfusion independent and restore production of beta globulin. So if I now take a step back and talk about overall stem cell research in India, it has been very active for more than 3 decades now. Early research was focused on adult hematopoietic stem cells and mesenchymal stem cells, but starting early 2000, there has been active research with embryonic stem cells as well. In the past decade, significant efforts have been dedicated towards iPSC research. Human embryonic stem cell lines were derived in India at the beginning of the century. The lines derived in India were one of the first lines recognized by NIH. Today, there is significant funding from the government promoting stem cell research, and there are stem cell research dedicated institutions. The national guidelines for stem cell research has been published by the government of India, outlining the requirements for stem cell research and therapeutic development. Now, this is a very important document as it sets the guidelines for research, development, and commercialization. One of the most important objectives of this well-thought-out document is to prevent premature commercialization of unproven stem cell-based therapies. There are a number of companies now pursuing development of stem cell-based and other cellular therapies. You will hear from other speakers about their activities. The current focus is on iPSCs, which are induced pluripotent stem cells, MSCs, and CAR-T cell therapies. Medical tourism promoting unproven stem cell therapies is still an issue and needs to be addressed. So to summarize, starting from bone marrow transplants in the early 80s, India has made significant progress over the last 40 years. Medical facilities offering stem cell transplants continue to increase in number with the state-of-the-art equipment and well-trained doctors. India has the infrastructure and skilled personnel to conduct stem cell research and is well positioned for innovation. Government has emphasized stem cell research and has provided funding to the academic institutions. They have provided national guidelines for stem cell research and development to set appropriate regulatory and ethical standards. However, venture capital for biotech startup has not been forthcoming due to the high risk of developing innovative therapeutics. This has definitely slowed the growth of companies focused on commercialization of stem cell therapeutics. Significant interest exists from companies in US and Europe to partner with companies in India for clinical development and marketing of products in India. Thank you very much.